Hello everyone. Today I would be starting a very important topic, that is pneumothorax. So first I would begin with the definition. What is the definition of pneumothorax? So see, basically when the air or gas enters in the pleural cavity, then it leads to lung collapse. Basically that is pneumothorax. इसका मतलब है हमारी लंग के बाहर एक प्लूरल कैविटी होती है. There are two pleura, a visceral pleura and a parietal pleura, and in between there is a pleural cavity. So when the air or gas enters in the pleural cavity, ये enter हो जाता है तब it leads to lung collapse or lobar collapse. Means the lung shrinks, there is shrinkage of the lung, there is flattening of the lung, and the function of the lung is lost. So basically that is lung collapse. So when air or gas enters in the pleural cavity, it leads to lung collapse or shrinkage of the lung. So basically that is pneumothorax. So it can be of two types, localized or generalized. When the visceral and the parietal pleura either stick together, then it is localized. When they stick together, then it is localized. And when they do not adhere or stick together, then it is generalized. So basically a definition of pneumothorax. So now I would be starting classification. What is the classification of pneumothorax? So see, there are two broad categories. First is the spontaneous pneumothorax and second is the traumatic pneumothorax. So first I would be discussing about spontaneous pneumothorax. So it is of three main types. That is open spontaneous, closed spontaneous, and tension spontaneous pneumothorax. And according to the etiology, means according to the cause, etiology or cause, it can be primary and it can be secondary. So now I would be talking about primary spontaneous and secondary spontaneous pneumothorax. So see, primary spontaneous pneumothorax, it is not associated with any underlying lung disease. There is no underlying lung disease. Without any underlying lung disease, it is primary spontaneous pneumothorax. So see, it usually occurs between 20 to 40 years of age, and the risk factors are smoking, tall stature, familial and subpleural bleps. Bleps मतलब जो air filled cavities होती है less than 1 centimeter in diameter, those are bleps. So basically these are the risk factors: smoking, tall stature, लंबा इंसान, familial means genetic, and subpleural bleps or air filled cavities less than 1 centimeter in diameter. According to the etiology, primary spontaneous without any underlying lung disease usually occurs in 20 to 40 years of age, and risk factors: smoking, tall stature, familial or genetic, and subpleural bleps. So basically this is primary spontaneous. Now secondary spontaneous, it is associated with an underlying lung disease. There is an underlying lung disease, and because of this there is pneumothorax. So now I would be talking about the causes of secondary spontaneous pneumothorax. So basically, see, first most important is COPD, that is chronic obstructive pulmonary disease, and it involves two parts. That is chronic bronchitis and emphysema. ये आपको पता ही होगा, emphysema and chronic bronchitis. Basically this happens in smokers. There is decreased total surface area for exchange of gases. So क्या होता है कि surface area कम हो जाता है, there is difficulty in exchange of gases is reduced. So basically that is chronic bronchitis and emphysema. So that is, it comes under COPD, that is chronic obstructive pulmonary disease. It is a irreversible obstructive pulmonary disease. And bronchial asthma is a reversible obstructive pulmonary disease. So this is the first cause. Now second is the cavitary active pulmonary TB. So TB में आपको पता ही है cavity हो जाती है in the apex of the lung. So basically that is cavitary active pulmonary TB, और ये है second cause. And these two causes, these are caused due to rupture, due to rupture of the emphysematous bullae and subpleural TB focus. So क्या होता है, there are bullae means air filled spaces greater than 5 centimeter in diameter in the lung. So उनका rupture हो जाता है, वो burst हो जाता है, there is rupture or burst of this emphysematous bullae means air filled cavities, air filled spaces more than 5 centimeter in diameter. So basically that leads to secondary spontaneous pneumothorax. And also there is subpleural below the pleura TB का focus उसका भी rupture हो जाता है, so it leads to secondary spontaneous pneumothorax. So basically these are the two main important causes, and other causes are bronchial asthma, which I have discussed. Suppurative lung disease means pus accumulation, there is accumulation of pus in the lungs. I would be discussing these topics in detail. Cystic fibrosis, very important disease, salt baby syndrome, CFTR gene mutation. I would be discussing this cystic fibrosis. एंड न्यूमोसिस्टिस जेरोविका न्यूमोनिया, एक न्यूमोनिया होता है, न्यूमोस ऑर्गेनिज्म होता है, न्यूमोसिस्टिस जेरोविका happens in HIV positive individuals. So I would be discussing this all in pneumonia. So basically these are the causes of secondary spontaneous pneumothorax. So now I would be talking about types of spontaneous pneumothorax. So see, there are three main important types. First is the closed spontaneous. So नाम से ही पता चल रहा है, the pleural tear which is formed is sealed or closed. जो प्लूरल टेयर होता है वो सील हो जाता है और क्लोज हो जाता है. उसकी वजह से क्या होता है, देयर इज नो कम्युनिकेशन बिटवीन द ब्रोंकियल ट्री, दैट इज द ब्रोंका एंड द प्लूरल कैविटी. सो क्या होता है कि एयर कैन नीदर एंटर इन नॉर एग्जिट आउट, air can neither enter in nor exit out of the pleural cavity, so it gets trapped in the pleural cavity. It gets trapped in the pleural cavity and it gets reabsorbed after a few days. So the symptoms gradually improve. So see, you should remember this pleural cavity pressure. So mean pleural cavity pressure है, it would be less than the atmospheric pressure, क्योंकि air अंदर आ ही नहीं रहा है, air is not coming inside the pleural cavity. So basically it will be less. Obviously the pressure of air would be less in the pleural cavity as compared to the atmospheric pressure. So basically this is common sense. So this is closed spontaneous pneumothorax. The pleural tear which is formed is sealed or closed, so there is no communication between the bronchial tree and the pleural cavity. So air is neither entering in nor exiting out of the pleural cavity. It gets trapped inside the pleural cavity and it gets reabsorbed after a few days. So the symptoms gradually improve. This mean pleural cavity pressure is less than the atmospheric pressure because the air is not entering inside the pleural cavity. Closed spontaneous pneumothorax. So this is the first part. First part. Now second part, open spontaneous pneumothorax. Open, basically on the name only you can see जो pleural tear बना है, it will be open. It will not be closed. So there is a fistula formation, means an abnormal communication between the bronchial tree and the pleural cavity. So क्या होता है, pressure of the pleural cavity is equal to the atmospheric pressure, because air can easily go in and out of the pleural cavity and the bronchial tree. So basically the pressure is same. So basically this is open spontaneous, and इसकी वजह से क्या होता है, तो इन्फेक्शन है, it can rapidly spread and it can cause empyema, pus fill हो जाएगा, pleural cavity में pus fill हो जाएगा, there is filling of pus in the pleural cavity, that is empyema. So infection can easily spread in the lung because of this condition, that is open spontaneous pneumothorax. The pleural tear which is formed, it is open, so there is fistula formation, abnormal communication between the bronchial tree and the pleural cavity. So pressure, जो pressure होता है mean pleural cavity pressure, it is equal to the atmospheric pressure. So basically that is open spontaneous pneumothorax. So now I would be talking about tension और valvular pneumothorax. In this the pleural tear, जो pleural tear होता है, it acts through a ball and a valve mechanism. Means क्या होता है? It acts as a valve. It allows a one way flow of air from the bronchial tree to the pleural cavity. So क्या होता है? Air trap हो जाता है. इसका मतलब है कि air बाहर नहीं आ पाता है during expiration. It gets trapped inside and air is sucked inside the pleural cavity when the patient coughs. When the patient coughs or he sneezes or when he strains, then it is sucked inside the pleural cavity and it gets trapped inside and patient is not able to exhale. So क्या होता है? The mean pleural cavity pressure जो होता है, mean pleural cavity pressure, it is positive throughout the respiratory cycle and it is greater than the atmospheric pressure. It is greater than the atmospheric pressure. एक बात समझिए, जो क्लोज्ड स्पॉन्टेनियस न्यूमोथोरैक्स होता है उसमें भी एयर ट्रैप हो जाता है, लेकिन वो रीएब्जॉर्ब हो जाता है. इट गेट्स रीएब्जॉर्ब्ड, सो द मीन प्लूरल कैविटी प्रेशर इज नेगेटिव and it is less than the atmospheric pressure, but in this case it is not reabsorbed. The air which is trapped inside is not reabsorbed when it is sucked inside during coughing, sneezing or straining. So basically the pleural cavity, mean pleural cavity pressure is positive and it is greater than atmospheric pressure. So basically this is tension or valvular pneumothorax. Now the second part of the classification, that is traumatic classification. It is basically divided into iatrogenic and non-iatrogenic. So I would be discussing this in detail. So now I would be talking about traumatic pneumothorax. So it is second part of the classification. It is caused due to, from the name only you can see, it is caused due to penetrating or non-penetrating injuries of the chest wall. ट्रॉमेटिक न्यूमोथोरैक्स हो जाता है और इट कैन बी आइट्रोजेनिक और नॉन आइट्रोजेनिक. आइट्रोजेनिक मीन्स इट इज़ कॉज्ड ड्यूरिंग डायग्नोस्टिक और थेराप्यूटिक इंटरवेंशंस. मीन्स जब हम कोई डायग्नोसिस के लिए प्रोसीजर करते हैं वरना हम ट्रीटमेंट देते हैं पेशेंट को थ्रू सर्जिकल ट्रीटमेंट. सो बेसिकली उसमें क्या होता है, इट कैन कॉज ट्रॉमा एंड इट कैन लीड टू न्यूमोथोरैक्स. सो बेसिकली दैट इज आइट्रोजेनिक न्यूमोथोरैक्स, आइट्रोजेनिक ट्रॉमेटिक न्यूमोथोरैक्स. So most common cause is transthoracic और transbronchial needle aspiration और biopsy. ये अपने पैथोलॉजी में पढ़ाई होगा. Means you aspirate the fluid or you do a biopsy, you cut the tissue and you send it for histopath. So basically that is transthoracic or transbronchial needle aspiration और biopsy. It accounts for 24%. Now subclavian vessels होते हैं, उनका पंक्चर करते हैं. Subclavian vessel puncture, it accounts for 22%. थोरैकोसेंटेसिस आपको पता ही है, जो रिब्स के बीच में नीडल डाल के जो प्लूरल फ्लूइड है वो हम ले लेते हैं, एस्पिरेट कर लेते हैं. सो दैट इज थोरैकोसेंटेसिस. इट अकाउंट्स फॉर 22%. सो दिस इज ऑल्सो सेकेंड आफ्टर सबक्लेवियन वेसल पंक्चर. एंड प्लूरल बायोप्सी सेम थिंग, 8%. And mechanical ventilation 7%. You should know this. These are facts. You should know this. These are facts. So basically this is iatrogenic. So non-iatrogenic, it is caused due to blunt or penetrating injuries to the chest wall, esophagus, lung, etc. So blunt means not sharp and penetrating. It's sharp, it can penetrate the chest wall. So non-iatrogenic नाम से ही पता चल रहा है कि it is not caused due to any therapeutic or diagnostic intervention. So now I would be briefing you about pneumothorax. So now I would be briefing you about pneumothorax. So first I would be talking about definition. So मैंने definition discuss किया था. Definition में क्या है? The air or the gas, it enters the pleural cavity. It enters the pleural cavity and it leads to lung collapse or lobar collapse. Means there is shrinkage of the lung. There is shrinkage of the lung and there is loss of function of the lung because of the air which is entering inside the pleural cavity. So basically that is pneumothorax. It can be localized or generalized. Localized में क्या होता है, जो visceral और parietal pleura होते हैं वो adhere हो जाते हैं. They stick together. And in generalized they do not stick together. So basically that is localized and generalized pneumothorax. So this is about the definition. Now I would be talking about classification. It can be spontaneous and it can be traumatic. Spontaneous में क्या है? There are three types. Closed spontaneous, open spontaneous and tension spontaneous or valvular spontaneous. Or according to the etiology, this spontaneous pneumothorax can be primary spontaneous pneumothorax or secondary spontaneous pneumothorax. और ट्रॉमेटिक में क्या है, इट कैन बी आइट्रोजेनिक और इट कैन बी नॉन आइट्रोजेनिक. सो फर्स्ट मैं स्पॉन्टेनियस न्यूमोथोरैक्स डिस्कस करूंगा. इन स्पॉन्टेनियस न्यूमोथोरैक्स देर आर 3 टाइप्स. क्लोज टाइप, इन क्लोज टाइप जो प्लूरल टेयर होता है, इट इज सील्ड, इट इज क्लोज्ड. So air can neither enter in, can abnormal communication between these two. So air can easily enter in and exit out. So basically क्या होता है, the mean pleural cavity pressure, it is equal to the atmospheric pressure. It is equal because there is free flow of air. So it is equal to the atmospheric pressure. सो बेसिकली क्या होता है, जो इन्फेक्शन होते हैं, इन्फेक्शन दे कैन स्प्रेड इजीली इनसाइड द लंग्स एंड इट कैन लीड टू एम्पाइमा. पस फिलिंग इन द प्लूरल कैविटी, बेसिकली दैट इज एम्पाइमा. सो इट इज अ गुड फीचर ऑफ ओपन टाइप ऑफ स्पॉन्टेनियस न्यूमोथोरैक्स. In tension pneumothorax, the pleural tear, it acts through a ball and a well mechanism. क्या होता है basically valve? It allows a one-way flow of air. So basically air is inhaled, air is sucked inside the pleural cavity when the patient coughs, sneezes or strains. So basically air gets trapped inside the pleural cavity. It does not get reabsorbed like in case of closed spontaneous pneumothorax. It gets trapped. Patient is not able to exhale. So basically क्या होता है, जो mean pleural cavity pressure, it is positive throughout the respiratory cycle. It is greater than the atmospheric pressure. क्योंकि air trap हो गया, it becomes more, the pressure becomes more. It is greater than the atmospheric pressure. So basically that is tension or valvular pneumothorax. So this is types of spontaneous pneumothorax, 3 types. Now according to the etiology, primary and secondary. Primary means it is not caused due to any underlying lung disease, and secondary means it is caused due to an underlying lung disease like COPD, tuberculosis, cavitary tuberculosis, pulmonary tuberculosis, then bronchial asthma, suppurative lung disease, cystic fibrosis, and many more. So basically this is primary and secondary. और प्राइमरी में रिस्क फैक्टर्स होते हैं. देयर आर रिस्क फैक्टर्स लाइक स्मोकिंग, टॉल स्टेचर, इट कैन बी फैमिलियल मीन्स जेनेटिक, एंड सब प्लूरल ब्लेप्स मीन्स जो एयर फील्ड स्पेसेस होते हैं वो. सो बेसिकली दिस इज अबाउट etiology, primary and secondary spontaneous pneumothorax. Now I would be talking about traumatic pneumothorax. In traumatic pneumothorax there are 2 parts: iatrogenic, non-iatrogenic. Iatrogenic means it is caused during any diagnostic or therapeutic intervention, and non-iatrogenic means it is not caused due to any diagnostic or therapeutic intervention. Iatrogenic में there are facts, you should know them, in which procedures it can lead to pneumothorax. So it is transthoracic, transbronchial, needle aspiration or biopsy, pleural biopsy, subclavian vessel puncture, and thoracocentesis, etc. So you should know this. These are facts. And non-iatrogenic means it can lead to blunt or penetrating injuries to the chest wall, to the esophagus, to the lung, etc. So basically this is about traumatic pneumothorax. So I have discussed about pneumothorax. Thank you.